Well, good morning. My name is Britt Nicholson. I'm the Senior Vice President for Development here at MGH. And it's my pleasure to welcome you to what's remarkably the 10th in our series of webinars having to do with COVID-19 under the general title of Answering the Call. Today's topic is the new normal moving forward after the pandemic. And it's proven to be actually one of the more popular topics that we've offered. We have over 330 participants who have registered for today's program. This is again the 10th in our series that started back just over a year ago in an effort to educate our community around a number of issues having to do with COVID-19. Be it the disease itself, treatments, vaccines, testing, again, a wide variety of topics. And today we're covering what we call the new normal, which is moving forward after the pandemic. Just a few housekeeping items. You do not need a video camera. You don't need a microphone to participate in today's program. At any time, if you have a question, please enter it in the Q&A button at the bottom, and we'll endeavor to answer just as many questions as possible once we get to the question and answer period. In order to do that, if you could keep your questions as short and as simple as possible, it helps us get through that number. The program is being recorded, and a shareable link will be sent out after the program. And it's my pleasure to sort of introduce the three speakers that we have today. The first is we're really fortunate to have the president of Mass General, Peter Slavin, who will be a part of this panel. In addition, Kaitlin Macdonald, who is a nurse practitioner's director of our Occupational Health Services here at Mass General. And she also serves in a dual capacity as the associate director of Occupational Health Services for the entire Mass General Brigham system. And then we have Dr. Olivia Okereke, who is director of the Geriatric Psychiatry program here at Mass General's Department of Psychiatry. And also, in addition to serving as director, she oversees the research center in the Department of Geriatric Psychiatry here at MGH. And so it's my pleasure now to turn the program over to Dr. Slavin.
Thank you very much, Britt, and good morning, everyone. I really appreciate your ongoing interest in learning more about COVID-19 and also your ongoing interest in Mass General Hospital as well. I'm going to start a little bit unusually, and that is with a little piece of literature, something that I have read many times over my lifetime, but never was this passage more powerful or resonated more with me than recently. And I think it really sums up what we've been experiencing at Mass General, and I suspect what you've been experiencing in your own lives. It is a passage I'm sure many of you are familiar with. It's the opening passage to A Tale of Two Cities by Charles Dickens. And he wrote, "It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was the epoch of belief, it was the epoch of incredulity. It was the season of light, it was the season of darkness. It was the spring of hope, and it was the winter of despair." I think this year has been characterized by that duality. On the one hand, terrible suffering, isolation, depression that has been run rampant across our country, around the world. And yet at the same time, incredible acts of heroism, ingenuity that are really inspirational as well. So with that as background, I just wanted to cover a couple of topics with you this morning. The first is just to give you a sense as to where we are with COVID here in late March 2021. If you were to plot the census of COVID patients at Mass General over the last year, look a little bit like a camel's hump. We went over a big hump last spring when we peaked at almost 400 inpatients with COVID. Then we saw the numbers go way down into nearly single digits over the summer last summer. And then in January, we peaked again at about 135 inpatients. That peak has also been coming down, although it has leveled off a bit. And as of this morning, we had 42 patients in the hospital with COVID-19. So that's good news. Things are returning to normal. We've opened up all of our operating rooms. We're caring for all sorts of patients that we typically care for. And so the hospital has returned to some semblance of normality. This year has been just an incredible year of learning for us. And I just wanted to mention 4 areas where we've learned so much. The first, which is not unique to healthcare, is how we've learned to use technology to be able to do things differently and remotely. Significant portion of our workforce, administrative staff, people who do data analysis for research have been working at home, and we're beginning to think about when and how to bring them back. Similarly, we've used telemedicine to care for many of our outpatients. Prior to this pandemic, telemedicine made up less than 1% of our outpatient care. Last spring, it was as high as 85%, now at about 30%. That's one thing that we've learned a lot about, and I suspect will be with us for the foreseeable future. Another thing that we learned so much about is, and we knew about this previously, but we learned so powerfully about it this time around, is just the relationship between what's happening in our emergency room, our ICUs, and what's happening in the community as a result of the social determinants of health. Particularly during the first surge, we just saw such a disproportionate number of patients coming with COVID-19 coming to us from communities of Chelsea, Revere, East Boston, and that we initiated an all-out effort with the leaders of those communities to try to do everything we could back then to slow the spread of the disease, and more recently to vaccinate as many people in those communities as possible. Third thing that we learned about is just the power of biomedical science and innovation. We saw it at the hospital where we were involved in dozens of clinical trials related to COVID. Our fundamental investigators worked on trying to understand how to develop new tests, how to come up with new treatments, vaccines for COVID. And I'm very pleased that the Johnson & Johnson vaccine came about in part through the work of one of our investigators in the Reagan Institute, which is an important immunology center within our hospital. And the fourth area that we learned so much about is just what we learned so much about healthcare workers and their commitment to their patients, their willingness to put their own lives on the line to be there for their patients and their loved ones. This pandemic has definitely taken a toll on our workforce. As I round in various units of the hospital, as I've been doing this past year pretty frequently, I'm pleased to say that I think our workforce is returning to a large degree to baseline, but I have no doubt that some of them will have long-term consequences as a result of this experience with post-traumatic stress and other issues. Next, I just want to turn to a very timely issue, which is vaccination. We are actively vaccinating people not only at Mass General Hospital under the Bullfinch tent, but across our health system. We're receiving at this point in time about 14,000 doses of the vaccine for new recipients on a weekly basis from the state. And we're certainly very hopeful that those numbers will increase as more vaccines become available. It really is the vaccine supply that is the rate limiting step in our ability and others' ability to vaccinate as many people as we would like. Certainly, my advice to you is to get vaccinated as quickly as you can, as quickly as you're eligible for the vaccine. Be persistent in using the various websites, call-in lines to get vaccinated. When it comes to our vaccinations, you don't have to do anything. We are using our electronic health record to identify our patients who are eligible for the vaccine in each phase and proactively reaching out to them to let them know that they can schedule an appointment with us to get vaccinated. I think that system has worked quite well. We are trying our best to overcome vaccine hesitancy. We've seen it in our staff. We've seen it in the community where certain racial ethnic groups are more reluctant to get vaccinated, and it's just so important that we work with everyone in all parts of our community to get vaccinated, not only for their own health, but for the health of the community at large. These vaccines that are currently on the market, the 3 of them, are extremely effective. Nobody who participated in any of the trials of these vaccines who got the vaccine died or was hospitalized. Some people, a small percentage of people, got mild illness, but these vaccines are extraordinarily effective, and it is a miracle of modern science that we have them just a little more than a year after this disease was first discovered. And the final message I just want to give to you is that although a number of you have been vaccinated, and hopefully the rest of you will be vaccinated relatively soon, it's still really important that we use all the public health measures that we've been urging people to use this past year: wearing masks when you're with other people, social distancing. As I said, even people who are vaccinated can get the disease either asymptomatically or with mild symptoms. It's unusual, but it does happen. And so even people who are vaccinated could potentially spread it to others. And so it's important, whether you're vaccinated or not, to take all the all the steps that we know are so effective at slowing or eliminating the spread of this disease. We're very proud that one of our former faculty members, Rochelle Walensky, is now the head of the CDC and is certainly trying through every media channel she can find to get the word out about the importance not only of getting vaccinated, but continuing to use masks and social distancing. So I'm going to end my remarks there. Look forward to participating in the Q&A, and we'll turn the floor or the Zoom meeting over to Kaitlin Macdonald, the director of our Occupational Health Service. Thank you so much.
Thank you, Dr. Slavin. Good morning, everyone. It's a pleasure to be joining all of you for today's webinar. It's hard to believe that a little over a year ago, there were these reports about international cases of pneumonia from an unknown cause. And then, as we all know, those cases were shortly linked to a coronavirus. And soon after, COVID-19 had spread globally, and, we all had to go into lockdown. We began needing to wear masks in public and social distancing. And I think what many of us thought would last for, a few weeks or a few months, has now become our new way of life. But in that time, we've learned so much about COVID-19, and, everyone out in the community has learned so much about, things like PCR tests and antibody tests and how to host meetings on Zoom. When this pandemic began in March of 2020, I don't think that many of us thought that a year later, we'd still be, masking in public or social distancing from family and friends. I think we'd all agree that while we're not back to what many of us would consider normal, but there has been a lot of progress made in the fight against COVID-19, and now we're beginning to adjust to what is our new normal. Just for review, there were 400,000 new cases in the last 7 days in the US, with a total of just about 30 million in the US over the past year. Thankfully, some states are now seeing a decline or a plateauing of cases, while others are seeing a slight increase. And, I know experts have different opinions on whether or not we might see, another surge in the future. And so that's why, as Dr. Slavin just mentioned, it's so important that we stay up to date with the guidance of the CDC, our state public health departments, and to receive the COVID vaccine when you're eligible. Even if you've already had COVID-19, you should still be vaccinated, because our experts are not yet sure how long protection from COVID will last after natural infection. And when you think about it, it's amazing that we now have access to 3 different highly effective COVID vaccines when this began a year ago. And as the occupational health director here at Mass General, I was the co-lead in opening and managing employee COVID vaccines. And over the past year, our employees have provided such high quality care for extremely sick patients while working long hours, having to learn about COVID-19 themselves, and worrying about their own friends and families. And so many of our employees were really grateful and excited to be able to come to the employee COVID vaccine clinics for their vaccinations. There were a lot of smiles, some happy tears, and just a feeling of hope that these vaccines would help put an end to a tough time in everyone's lives. I remember, one of our first vaccine clinic days back in December, one employee commented that the vaccine was a bright light at the end of a long tunnel for her. So, according to the CDC, 26% of Americans have received one dose of a COVID vaccine and 14% are fully vaccinated. So just as a reminder, you are considered fully vaccinated for COVID-19 if it's been more than 2 weeks since your second dose of Moderna or Pfizer vaccine, or more than 2 weeks after receiving the single dose of Johnson & Johnson vaccine. And over the last few weeks, the CDC has released some new guidance regarding people who are fully vaccinated. So the CDC says that fully vaccinated people can now visit with other fully vaccinated people without needing to wear a mask. You can visit indoors with unvaccinated people from a single household if they're at low risk for severe COVID disease. But research is still ongoing on how well vaccines can stop the spread of COVID-19 to others and how long the vaccines will provide protection. And because of that, there are some things that even fully vaccinated people should continue to do. They should continue to wear a well-fitted mask and adhere to physical distancing in public. They should continue to do frequent hand hygiene with a hand sanitizer that's at least 60% alcohol-based if soap and water might not be available. Also wear a well-fitted mask when visiting with any unvaccinated person who's at increased risk for severe COVID-19. And of course, continue to avoid medium and large size crowds and gatherings. And most importantly, isolate away from others and get tested if you're experiencing any COVID-19 symptoms like fever, cough, muscle aches, new loss of taste or smell, sore throat, or runny nose. Just as a reminder, these symptoms typically appear 2 to 14 days after exposure to COVID-19. And something to keep in mind is that as we approach April and May, it's really important to pay close attention to your symptoms, given that COVID-19 symptoms can actually mimic some allergy symptoms. Some symptoms like the fever, chills, muscle aches, they're not associated with allergies. There are symptoms like the sore throat, congestion, runny nose, headache, or even fatigue can be associated with either COVID-19 or allergies. If you have itchy or watery eyes or sneezing, that's really typical of seasonal allergies and not COVID. But if you typically have allergy symptoms at this time of year and you're experiencing symptoms that differ from what you typically experience with your allergies, please err on the side of caution and contact your healthcare provider to discuss if testing is needed. And before I wrap up, just what are some general practices to staying healthy this spring? Keep your regular medical appointments for annual physicals, preventative visits, and specialist check-ins. Keep up to date with other vaccinations like your pneumonia vaccines. If you need medical attention, contact your treating provider or seek emergency care if needed. We all know that during the beginning of the pandemic, some patients put care on hold or did not seek treatment for concerning symptoms because they were worried about coming into medical facilities. However, we know how important it is to have appropriate medical care, and because of our infection control policies, hospitals really are safe environments to visit for care. Anyone with a chronic medical condition should keep a 30-day supply of medicine in the house. And it's always a good idea to keep a supply of other medications like fever-reducing medications and food in the house in the event that you're not feeling well. If you're interested in weight management, talk to your healthcare provider about what diet might be right for you based on your medical history. Increasing water intake can be very helpful. If you're like me and not a big water drinker, try swapping out one soda or coffee a day for a glass of water to start. And right now is a great time to become more physically active. You know, the weather's improving, so we now have the opportunity to be outside more, which allows for easier physical distancing, take a walk, ride a bike. A lot of gyms are hosting outdoor classes, which is great. And as more people become fully vaccinated, more and more of our normal activities will be able to return over time. Thank you so much for your time. And I will now turn it over to Dr. Okereke.
Thank you to Kaitlin, and thank you, Dr. Slavin and Nicholson, our organizers, and of course, all of you who are attending this morning. I'd like to touch on 3 additional topics related to some of what we've heard earlier. I'll talk about a little bit more about what we're calling this new normal, especially as it relates to mental health and wellness. I'll talk about this transition that we're calling the pandemic transition and how to mentally prepare for moving forward. And finally, a little bit more about what we can do to care for ourselves, our family and community, friends and colleagues. So this is a period of just tremendous change. This is true for everyone, not just older adults, although that is my focus as a geriatric psychiatrist. Our daily habits, lifestyles, living environments have changed. The look and feel of our neighborhoods, businesses, storefronts, the world and society around us have changed. And so it is normal to feel a bit taken aback by that, and important to give ourselves space to reflect on that and to go easy on ourselves and pace ourselves as we gradually readjust to some changes in daily life. Now, of course, for mental health, this was very affected within the short-term immediate impacts. Anxiety and depression, which are the most prevalent psychiatric conditions, anxiety the most prevalent, about 30% lifetime history, depression 20% lifetime history in the population. These tended to increase during the acute phases of the pandemic, as well as grief. There was the acute grieving that many people are going through. In the long term, this is no different, as well as during the transition. So people who had mental health issues prior to the pandemic or whose mental health worsened during the pandemic may have more challenges transitioning during this period. And we need to acknowledge that many people are experiencing protracted issues related to grief and loss related to the pandemic. This is particularly true for older adults who may actually be surviving many of their oldest friends and family members. And older adults who contracted COVID but survived may be coping with lingering health issues, neurological, physical health, and mental health impairments. And then, of course, there's the loss and disruption of our usual support structures, social connections. Those things will now need to be restored and bolstered. So this new normal isn't really a fixed state, right? It's going to be a dynamic and evolving space, and we need to manage our expectations on what should or must happen by a certain time. So instead, we can move away from expectations that everything will have to be exactly as it was, or that there has to be a specific time when all things will return to normal. Rather, we can think of this environment as a new set point. And we heard earlier about vaccines, and I think this is going to play a very important role in mental health at this time. So vaccination is something that tends to increase people's confidence around feeling protected from the worst complications of COVID, and enable people to feel a little bit more confident about spending time out of doors, interacting with other vaccinated friends and family and loved ones, and reducing the sense of confinement. So this means that as vaccination is mobilized throughout the community, it may yield improved outlook for mental health to the extent that it can remediate what we already know are some of the major precipitants for mental health deterioration: social isolation, disruption of schedules, health risks and health impairments, anxiety, loss. So vaccination can play a big role in that. And we heard about what an emphasis MGH has placed on this among employees in the community, including mitigating inequities in access to vaccination out in the community. And for the most part, people will be focusing on restoring what they can, getting back to work, more kids getting back to campus and school, and getting back to more regular visits with each other in home or in care facilities for those of our loved ones in care facilities. But this transition, I think, is also going to bring many unexpected opportunities. So, for example, among older adults, out of necessity, many people acquired new skills and new facility in using technology, including video formats like we're using right now. And this has increased people's sense of confidence and bolstered their self-esteem and sense of self-efficacy, which tends to improve mood. Also, it's facilitated forging of new connections, friendships via video chats, picking up new interests or hobbies, attending new meetings via video, and actually continuing to use these things and to leverage those connections that have been forged during this challenging period can help people during the transition. And then finally, I'd like to touch on a few points of how to care for ourselves and others. So as a general rule, using many of the same tools that got us through the worst of the pandemic are going to continue to be very helpful for us now. So we heard earlier about the importance of regular mental health care. We saw a 30% surge in our use of, in the utilization of our patients of mental health visits via virtual formats just in the first few months of the pandemic. So people have been connecting to mental health care, but other types of healthcare did fall off the radar a bit. And so getting people back in touch with regular health appointments is going to be important. We heard about healthy eating and exercise and lifestyle habits. That's going to be important to continue. But one of the things a lot of people used for their coping was structure, setting times for waking up, for going to bed, for doing certain activities during the day. It helped break up the monotony and improve the structure of the day. And that turns out to be something that actually may help us get through this transition. So all of those things, in addition to self-care exercises of relaxation, meditation, going for walks, or whatever else is helpful to us, will continue to be helpful. Now, checking in with friends and family during periods of social distancing and isolation was essential over the last year, but the focus of this may change during this transitional phase. We're going to be asking how other people are doing in terms of getting vaccinated, maybe reaching out to them about assisting with that, assisting with getting more connected to technology if that was a deficit area, helping people cope with the stress and ramifications of getting back to work, economic fallout or educational fallout of the challenges of the last year. And so I think that's how we need to be thinking as we're moving forward. And we heard also about the fact that this is a dynamic space, so we want to keep in touch with the public health recommendations led by Dr. Walensky and others at the CDC, because that's going to give us a sense of what we might be able to do where and when. So I just like to say in conclusion that this is really a moment to reflect on all the changes we've been through in the last year and how we can use some of what we've learned to help us through this period of transition and moving forward. Caring for ourselves and our communities has to be prioritized. And it turns out that bolstering care for ourselves and others, social connection, being involved in that effort is actually a benefit to our mental health as well and can play a protective role as we move forward. And so with that, I'd like to turn it back to Dr. Nicholson for our panel discussion.
Thanks very much, Olivia. Not surprisingly, we have a flood of questions that are coming in. And the first one I'm going to direct to you, Kaitlin. It's one I haven't heard before. The questioner is saying, it appears that we haven't had much of a flu season this year. And as a result, is your thinking changing about the recommendation that all staff wear masks even though they've been vaccinated, going into subsequent flu seasons?
So what has been great, one of the great things about this pandemic has been the low flu activity. And that really is because of the masking and physical distancing that we're all practicing. I think this would be something that would need to be discussed with, our infection control directors, if this is something that would continue. And of course, it's all dependent on, where we are with COVID, over the next few months into the next flu season as well.
Okay, thanks. Olivia, this one comes in for you saying, I know you're a geriatric psychiatrist, but I'm curious if you have any recommendations for warning signs that we should be looking for with family members or loved ones who may be experiencing a stress that's not necessarily overt.
That's a really great question. There are so many ways that people respond to stress and to these types of circumstances, and they may not always be readily apparent. And so it's definitely a good idea if you have any concerns, to just ask how someone is doing and see sometimes what they'll say. Sometimes people are surprised that just being asked how they're doing, they may come forward and say, I'm struggling a little bit with things. Asking the question rather than sort of worrying about, is something going wrong, often can be very helpful. And if you do know, and this is important since as I mentioned before, mental health issues are prevalent. So if you do know that someone has a history of prior anxiety and depression, and this is a period of exacerbation, then it might make it a little easier to sort of bring up, hey, have you checked in with your regular care? Maybe it might be worth looking into that. I think those are the kinds of things that might be helpful in that situation.
Peter, as an out-of-state patient, how soon do you think I'll be able to start scheduling follow-up appointments with my oncologist at MGH? I used to have annual check-ins.
Mm-hmm. I mean, some of those are available now. So if you have a need to see one of our physicians, please get in touch with their office and see if that can be arranged in person or remotely or through telemedicine. We do face some obstacles in providing telemedicine care to people who live in other states. Physicians licensed in Massachusetts and not licensed in other states have difficulty providing care via telemedicine to people in those other states. So get in touch with your physician's office. As I said before, at the peak of this pandemic, 85% of our care was being delivered by telemedicine, but that's down to 30%. I guess the flip side is 70% of our outpatient care is now being done in person. So please get in touch with your doctor. And obviously, I guess the other complicating issue when you're coming from out of state are just the rules of quarantining. So you'll just need to be mindful of those as well.
Kaitlin, this one's for you. I said, you're in a unique position as being Director of Occupational Health Services to see firsthand issues around vaccine hesitancy. Since it's my understanding that even though all employees at Mass General have had access to the vaccine for several months, only about 75 to 80% have been vaccinated. So there are two parts to this question. One, what techniques or what things are you doing to try to encourage those that have not been vaccinated to get vaccinated? And what are the main concerns that you're hearing from those who are choosing to delay or not get the vaccine?
I'll start with the second question. What are some concerns that people are expressing? I think it's a couple things. One, some people feel like these are new vaccines. They've just been approved, and they want to make sure that they're safe. Some people have said that they would like to wait a little while to, while other people get vaccinated, to see how everyone does and what everyone experiences. There has been a lot of work done throughout Mass General and throughout, the Mass General Brigham system on vaccine hesitancy. There's been a lot of campaigns that have gone on to try to educate, employees just about how safe these vaccines are. There's been some different sessions with some of our departments that might have lower participation in this, just to give them the opportunity to, ask any questions that they have. Here in occupational health, something that we do with all of our new employees who come in to be cleared by us before they start, right on their first visit with us, we start to talk to them about the COVID vaccine, that it's available to them, and just how important it is that they receive it. And then we provide guidance on how they're able to go ahead and get scheduled for that vaccine. So I think that's been really helpful as well.
Thanks very much. And Olivia, this one's for you. It says, Dr. Okereke, your research focuses on optimizing brain health and well-being in aging. What impact have you seen in your work as a result of this pandemic?
Wow, that's a really great question. I'll try to keep it brief because there's a universe of answers I could give over what we've seen over the last year. But I'll focus it by saying that we've seen both positive and negative impacts of COVID. So in terms of what's been negative, among people who have experienced and survived COVID, there's been a huge amount of attention on this. And I think a lot of you have heard about this in earlier webinars on what has emerged as a neuro-COVID or some of the neuropsychiatric complications and fallout in terms of symptoms, complex of symptoms among people who've had COVID. And generally, with aging as a more vulnerable brain, and that means that some of these impacts will disproportionately be experienced by older adults. Outside of neuro-COVID, we've seen exacerbations of anxiety and depression, primarily, acute stress, bereavement. These are the kinds of things that have been most common. In terms of social isolation and loneliness, that has also been a precipitant and a stressor. And also in the early waves of the pandemic, fear. Just that, among older adults, it was a really quite fearful experience when we, especially early on when we really didn't know very much about it. And we knew that it was very much disproportionately affecting older people. So I think that's kind of where we saw the worst of the impact. And we were very fortunate that we were fully mobilized to be able to do virtual care during that time. Our patients within the geriatric outpatient practice utilized this. And like I said, we had like about 30% bump compared to year on year. So that's compared to pre-COVID in terms of utilization. So that I can say was part of the negative, but the positive, and we've been studying this. So I'll keep it brief, but we presented at the annual meeting last week of the American Association of Geriatric Psychiatry some early data where we're seeing people feel positive changes around their sense of self-efficacy in coping, people who were able to make adaptations in terms of getting meal, medicine and food delivery, people who were able to use more technology, people who leverage that to increase their social connections or virtual connections, that actually there's an increased feeling of positivity about what they were able to manage. So the resilience actually is something we saw as well. So I'll stop there.
Okay, thanks very much. It was obviously a broad question. Kaitlin, this question comes in. It says, if I'm vaccinated, how safe is it to ride public transportation?
So the good news is about public transportation is that masks are required. And I think that there are some steps that you can take just to provide a little bit more protection for you if you decide to take public transportation. So certainly if you can travel during non-peak hours where there's likely to be less people on public transportation, that's great. We sometimes don't have that opportunity. So avoid standing in crowds if possible. So when you're at the bus stop or the train station, don't stand directly with a crowd, or if you're on the train or bus, maybe skip a row in between yourself or others. Make sure you do hand hygiene, as soon as you get off the bus or the train, and also perform hand hygiene as you arrive. And, don't eat or drink on public transportation. So, I know it's hard in the morning to not drink your coffee, but, don't pull your mask down for a sip of coffee on the train. And then, you have good protection between the mask and your vaccine.
Okay. Peter, what is the MGH's biggest success from your point of view from this last year? And the flip side of that, what's the biggest learning or challenge that's come out of this last year?
Mm-hmm. It's really hard to put my finger on one biggest success. I guess I just have to say that the mobilization that happened during the first surge was truly extraordinary. We didn't have a lot of time to do it. We had to expand our ICU capacity, our general bed capacity, redeploy staff, convert general care units into ICUs. It was an operational tour de force. So if I had to pick one thing, that might be it. If there was one thing that we could do over again, I guess, again, we realized pretty soon that we were seeing a disproportionate number of patients with COVID coming from Chelsea, Revere, East Boston. I guess if we had to do it over again, we might have anticipated that and intervened before the patients started showing up in our emergency room and in our intensive care units. So it was entirely predictable. I mean, using 2020 hindsight, entirely predictable that those communities that have crowded housing conditions, use a lot of public transportation, et cetera, and face a variety of other adverse social determinants of health, we're going to be disproportionately affected. And I guess if we could turn back the clock, I wish we and others had, not only in the Boston area, but across the country, had more proactively intervened in those communities.
Thank you. So Peter, I'm going to come back to you with this one. The questioner says, I think there's been recent research in this area, but can you tell me what the current estimated vaccine protection level is for otherwise healthy immunosuppressed transplant patients?
There was some recent data, I think it was among transplant patients that that gave the impression that the response was low. I think it was in the 14% range, as I recall. But as I also recall, the study only examined patients after only one dose of one of the 2-dose vaccines. So from my perspective, to draw the conclusion that the vaccines don't work very well in transplant patients is premature. I think what would be more valuable is looking at antibody titers or infection rates after the time intervals that were mentioned earlier, 2 weeks after the second dose for Moderna or Pfizer, or 2 weeks after a J&J vaccine. So there was a discouraging study that looked after just one dose and found low rates of antibodies. But I'm hopeful that when those same patients are studied later after their second vaccination, that the results will be higher. Certainly, there's no risk to transplant patients of getting the vaccine. So I would strongly recommend that they get it, and hopefully it will turn out to be more effective than this very preliminary data indicated.
Okay. Olivia, this comes from an individual who's quite concerned about a friend. It says, I have a friend in Florida who appears severely depressed, very thin, and unfortunately will not go to a doctor in our state or pretty much anywhere, even though he is vaccinated. Is there any possibility for virtual mental health treatment for him at MGH?
Yeah, that does sound like a very concerning situation. So I'll say a few things. When there's that level of concern about someone who's not only very depressed, but appears to be getting thin, right? So the depression is affecting them to the point where they're not eating, they're not maintaining their vital functions as well. It's important to prioritize the impact on physical health as well. So if that's someone where, for example, it might be easier to just get them in to see their primary care doctor, pulling, the idea of seeing a mental health clinician out of the framework, if that helps at all, or getting to an urgent assessment, that could be something to prioritize depending on how ill appearing this person really is. Now, in terms of getting care at MGH, as we heard earlier from Dr. Slavin, we're kind of in this transitional phase where some of the exceptions around our ability to do out-of-state virtual care are evolving. That said, there are people who do have licenses outside of the state of Massachusetts who can do these kinds of things, or partners that we have outside our state that colleagues that we know of and can help in that space. But I think first and foremost, I think when there's this degree of concern about the physical as well as psychological, I think getting in to see any medical doctor, regardless if they're psychiatric care or mental health evaluation, will be a priority.
Thanks very much. I think we've got time for one more. And Kaitlin, I'm going to send this one back to you. The question is, how soon after the second dose of a COVID vaccine can I get my Zoster vaccine?
So right now, there hasn't been a lot of research done on how closely vaccines can be given to, after a COVID vaccine. So right now, the current recommendation from the CDC is to wait 14 days in between a COVID vaccine and another type of vaccine.
Okay, great. Well, we've reached 11:45. Again, a number of other sort of good questions that we weren't able to get to. I'd just like to thank everybody for their participation, especially the panelists today and the audience for these terrific questions that came in. As was emphasized by several of our panelists earlier, we certainly appear to be making headway with this pandemic, but this is no time to let our guard down. Wearing your masks, practicing social distancing, and moreover, just paying very, very close attention to the CDC guidelines. We know from personal experience that we have a very wise leader at the helm, somebody who can be trusted. So best of luck to you today. Have a good weekend, and as always, be safe. Bye-bye.